This video is for men looking for a scientifically proven exercise routine to improve their erections. It may also reduce the need to pee so frequently at night. My name is Daniel Lawrence, physiotherapist and licensed healthcare professional. All three parts of this video are important, so if you don't get time to watch them all, then make sure you save the video and subscribe to the channel so you can come back and watch them at a later date. Now, a lot more men suffer from erectile dysfunction than you may realise. Some men suffer short episodes, while others struggle more regularly and it's more of an ongoing problem. This research here shows that 20% of men may be suffering from this common problem. Due to YouTube's policies, we won't be showing you any pictures of male genitalia. What I can show you is this. Think back to when you last had your blood pressure tested. As the cuff tightened around your arm, you would have felt the veins in your arm bulge and your arm feel tight and stiff, until the cuff was released and then the arm relaxes and the blood flow returns back to normal. Well, this is what happens when you get an erection. Your penis fills with blood and the blood is then held in the penis with the help of the squeezing of muscles called the ischiocavernosus and the bulbocavernosus, acting like a natural cuff to hold the blood in your penis in the same way that a blood pressure cuff temporarily holds the blood in your arm. So these two muscles are part of your pelvic floor muscle collection, which, as the name suggests, is a floor of muscle across the floor of your pelvis. So in this video, I'm going to give you an evidence-based strengthening plan for your pelvic floor muscles. But once again, make sure you watch all three parts of the video because these stretching and release techniques are also really important. So let's get started with the strengthening, which in this study helped 74.5% of the male participants achieve normal or improved erections. To do these exercises, sit down in a quiet place with a timer. I'm going to use the stopwatch function on my watch. You could use a stopwatch on your phone or keep an eye on the clock on the wall. So to strengthen your ischiocavernosus and other pelvic floor muscles, you need to gain an awareness of where they are and how to get them to contract and relax. Usually when you do strengthening exercises, they're easy to see and teach because there's lots of movement going on. However, with pelvic floor muscles, there's not actually any movement to see. Well, that's not strictly true. There are actually two movements that you could see. The first one is a slight lifting or withdrawal of the penis, sometimes described as a shortening of the penis, but men don't usually want to do exercises where that is described as the aim. So a lifting and withdrawal is the best thing to think about. And the other one is a lifting of the testicles. Obviously something that's much easier to see on yourself by looking at your reflection in a mirror. But when you're doing these exercises, you don't actually need to stand naked in front of a mirror to see these movements. Although it could sometimes be helpful, it may not be that comfortable to do. You might be self-conscious and also not very practical. So sitting as you are, we're simply going to use our mind to muscle connection and use metaphors and imagery to get an understanding of which muscles we're trying to contract and which movements we're trying to initiate. So let's get started. Relax your breathing and relax the muscles around your pelvis, including your buttocks. Now to tighten your pelvic floor, imagine you're in the queue for the loo and you had to hold your bladder. When you tense up those muscles, you should feel a slight lift in your penis and certainly a lifting of the testicles. Hold that contraction and then relax. Another way to describe the contraction of those muscles is imagine that you are going for a pee and you need to stop mid-flow. When you're urinating and you cut that off mid-flow, those muscles which stop that movement again are your pelvic floor muscles. Once again, contract those muscles, hold them for a couple of seconds and relax. Now to contract the muscles at the back of the pelvic floor, they're muscles around your anus, imagine you need to break wind and you need to stop yourself doing so. So go ahead and tighten up those muscles and relax. Now, tighten them at the same time. The ones at the front and the ones at the back, tighten them up. Hold for a couple of seconds and relax. When you do that, you should feel a general lifting of your pelvic floor muscles. Between your front and your back, those muscles should increase in tone and you should feel as if they're lifting slightly off the chair. So just practice those pelvic floor contractions again, the front and the back at the same time, lifting that pelvic floor, holding the contraction for a couple of seconds, and then relaxing, making sure your breathing is relaxed and the muscles around your pelvis, such as your buttocks, are also relaxed. There's no need to be doing any tensing of those larger muscles or breath holding. Okay, well done. That was our warm-up. Now we're going to move on to the first exercise routine. It helps if you have the clock or your timer ready. What you're going to do is those pelvic floor contractions, front and back, lifting up and holding for 2 seconds. Then relax for 4 seconds and then repeat 10 times. This should take you around a minute. So at this stage, pause the video whilst you have a go at 10 times 2-second contractions with 4 seconds rest in between. Well done, I hope you got on well with those. Now for the next exercise, we're going to do the same thing, but we're only going to contract this time with 50% effort. So less intensity, less muscle contraction through the pelvic floor, but we're going to hold the contraction for longer. We're going to hold it for 30 seconds. So a lower level contraction for a longer duration helps you to build your endurance, and yes, it helps you to last longer. So let's begin the exercise. Contract the pelvic floor muscles by about 50%, so 50% effort, and hold that contraction for 30 seconds. Use a timer or a clock on the wall so you don't have to count in your own mind. Then you can use your attention to focus on the muscle contraction rather than trying to count down in your own head. So have a go at doing this exercise right now and pause the video if you need to. Well done. So those are the 2 strengthening exercises, the quick contractions and the slow sustained contractions, working on both quick maximal strength and more gradual sustained endurance. Now it's recommended that you repeat both the quick contractions and the sustained contractions 2 to 3 times each, 3 to 4 times per week. And you probably want to know, how long will it take to get results? Well, of the 55 men participating in this study, 74.5% reported normal function or improvement, as I mentioned earlier, and this happened after 6 months. But you may start to experience results after a few weeks, especially with nighttime erections. Now, before we move on to the next important section of this video, here's a few top tips for you. Firstly, plan when you're going to do your exercises so you can do them in a quiet and relaxed environment. It's not ideal to just try and do them anywhere or whenever you are standing in a queue. You'll need to focus and complete them without distraction. Number 2, relax. It's equally important to relax your pelvic floor muscles as it is to contract them and, in this case, strengthen them. That's why it's not advisable to do too much pelvic floor exercise, as you also need to allow time for relaxation and recovery. Now we're going to cover this in the next section of the video. Before we move on, another top tip is positions. It's been suggested that doing the exercises in the desired positions can yield better results. Perhaps a little awkward if you're doing them at lunchtime in the office, but still something to think about. A final thing before we move on, some YouTube videos show people doing this bridging exercise as a potential exercise to help with the erectile dysfunction. But the bridging exercise in itself simply tightens up the glutes. What we need to do is target and activate and strengthen those pelvic floor muscles, just like we've been doing. Larger exercises which contract the larger muscles of the body are probably just going to be a waste of time and can sometimes even make the situation a bit worse if you're suffering from too much muscle tension. So yes, ironically, I'm saying be careful what you watch on YouTube. A leaky bladder and erectile dysfunction can sometimes be caused by tight pelvic floor muscles. These tight pelvic floor muscles can restrict blood flow into the penis and restrict a full emptying of your bladder. Now you may be wondering, why might your pelvic floor muscles be tight? Well, it could be caused by not allowing yourself to go to the toilet on a regular basis, and this can be quite common with some jobs, such as long-distance drivers, for example. Another common cause is irritable bowel syndrome, known as IBS, and perhaps most commonly, general anxiety. Anxiety can cause all of your muscle tension to increase, and that includes the muscles in your pelvic floor. Now, this next one may surprise you. Doing too many sit-ups, doing too much core work, and constantly tensing your pelvic floor muscles can leave them fatigued and tight. So yes, it is possible to do too much pelvic floor exercise, which may lead to fatigued and tight pelvic floor muscles, which could be causing some problems. To help you relax your pelvic floor muscles, try this stretching, breathing, and relaxation technique. It's called the Happy Baby Stretch. So you can do it lying on the floor with your feet up against the wall, like so, and your knees and feet wide apart, so you get a good stretch through your groin. Once you're in position, focus on your breathing. Slow your breathing down, relax your breathing, and if you can, breathe through your nose. You should feel your abdomen rise and fall as you breathe, and your chest should be relaxed. This shows that you're breathing with a normal and relaxed breathing pattern. So you should feel your abdomen rise as you breathe in and fall as you breathe out. Gently pull your knees apart and stretch your knees a bit further up over your abdomen by pulling over your knees with your hands, as I am here, or by getting yourself a little bit closer to the wall so the wall pushes against your feet for you and you can keep your arms a bit more relaxed. Hold this position for 10 breaths, with each breath being slow and relaxed. Here's some alternative positions. So we did one with me pulling over my knees. You can also hold onto the ankles. If you're not pushing against a wall, you can pull around the ankles and pull the feet towards the pelvis like so. Or the true Happy Baby stretch is where you hold onto your feet and have them above you here and then pull down with your arms so your knees are being pulled down into your sides. That's not that difficult to do, but if it feels a bit uncomfortable, or when you do it, if you're straining, remember this is supposed to be a relaxation exercise. So if you're struggling and straining to get into this position, then this is probably not helping to relax your pelvic floor muscles. Okay, pause the video and have a go. Okay, well done. Hope you're feeling a bit more relaxed now. We're going to move on to part 3, the final section of the video. Welcome to the final part of the video. So you can use foam rollers and massage balls to help release tight muscles, and the pelvic floor muscles are no exception. What I won't be using, however, is this large, hard, spiky ball, which is clearly inappropriate for the pelvic floor. So we'll get rid of that one. And what I'm left with here is a small diameter foam roller and a firm foam massage ball. You could use a tennis ball, and I've also seen some people use a water bottle instead of a foam roller. So let me show you what to do. Let's start with a ball. Sit your right bum bone onto the ball, take some of the weight through your arms, and then gently roll the ball inwards towards the center of your pelvis, so it's coming in over the pelvic floor muscles. Apply as much pressure as is comfortable. Pause for a few seconds. Offload the ball and move back slightly so that the ball rolls forwards in that pelvic floor region. What you can then do is move around in small circles or glide forwards and back so the ball gently rolls forwards and back in that pelvic floor area. You may need to experiment a little bit with positioning, and if you find an area that feels quite tender or tense, then apply a little bit more pressure, relax your breathing and hold that position for a few seconds in order to get some reduction in muscle tone and what should feel like a bit of a release. After about 20 to 30 seconds, take the ball out and repeat that on the other side. Sit your bum bone onto the ball. Let the ball come in towards the middle of the pelvis and let the ball sink into the pelvic floor muscles. Move in small circles. Glide forwards and back carefully, and if you find any particular tender points, pause, apply a comfortable level of pressure, Hold that pressure for a few seconds. See if you can feel the muscle tone reduce, the sensitivity reduce, and a feeling of a release. Now, when you're doing those techniques, just to be clear with you, directly rolling the ball over your anus is not helpful and not necessary. So you can also use a small foam roll or a water bottle, which you're going to sit on a bit more like a saddle, and it's a bit harder to move around in comparison to the ball. But have a seat on that, start by sitting up straight, and then begin to roll forwards. Pause if you feel any particular sore tender points. You can move your weight to one side or the other side, and then back again. Using the roller is a simpler way to go about doing this exercise because it doesn't move around as much, and you're simply left with the option of rocking forwards and backwards. However, using the ball can be more targeted, and although it can be a bit more difficult to coordinate, if you do have the ball, then you can get into those sore spots a little bit easier and a bit quicker using the ball. So have a try at both of those, and quite simply, you are using the massage tools to get into those tight muscles and cause some reduction in tone, sensitivity, and the feeling of release. Now, I do hope you find all of the strategies that we covered in this video helpful. Let us know in the comments which ones you found the most helpful. And thanks for watching the Physio channel. Hopefully you subscribed. We'll see you in another video.